So hey everyone, welcome to CoreVet. So today in this particular video lecture, we'll be discussing about the sulfonamide class of drug. Okay, so let's start with its general information about the sulfonamide. So if we talk about the sulfonamide now, so it was the first antimicrobial agent which was used against the pyogenic infection. The pyogenic infection that is the most common is caused by the Staph aureus and Streptococcus. These are the common commensal for the pyogenic infections. So this particular class of drug, which is the sulfonamide, it was the first antimicrobial agent which was used against the pyogenic infections. Right. So if we talk about the structure of the sulfonamide, so what we analyzed that it was quite similar with that of the para-amino-benzoic acid. Not functionally, but in the structural aspect, the sulfonamide was quite similar to the para-amino-benzoic acid. That's why it is known as the analog. Okay, analog for the sulfonamide. Okay, so if we talk about the structural aspect, so most of the antibacterial sulfonamides that has been formed, we will discuss later about the classification of the sulfonamide, where we are going to look for several sulfonamide drugs, right? So how these classes of the drugs that we are going to discuss later on in the classification, if we talk about how they are formed by the chemical substitution at the N1 level. Okay, so at the position N1, okay, at the position N1, when we are going to make a substitution with several groups, right? So when we are going to make substitution with several groups at the N1 position, then we are going to get several drugs related to the sulfonamide class, right? And what's the importance of this particular N4 position? So this N4 position is only responsible for the antibacterial activity for the sulfonamide class of drug, right? So that's what the importance of this particular N4 position is. Okay, now if this particular N4 position is altered, then there will be loss in the antibacterial activity of the sulfonamide. That you should remember, that if any alteration will be going to made at the N4 position in the structural component of the sulfonamide, then what would it lead to? It will lead to the loss in the antibacterial activity. Okay, so I hope this particular part is clear. And the next important point about the sulfonamide is that it follows the law of the independent solubility. Now, if we talk about the spectrum, means that what is the range of the action for this particular sulfonamide, means how much organism does it can affect. Okay, so if we talk about the spectrum of the activity for this sulfonamide, so we could clearly see that its action is on the gram positive aerobes. Okay, not anaerobes, the gram positive aerobes, right? Like Streptococcus pyogenes, pneumococcus, and your MSSA, means the Staph aureus, which is the resistant to the your methylene, right? Now coming on to the gram negative aerobes. So the gram negative aerobes which are susceptible towards the sulfonamides, that are E. coli, Enterobacter, Shigella, Salmonella, your hemoinfluenza, okay, Haemophilus influenza, and then Moraxella, then Nocardia meningitis. Okay, so the Nocardia meningitis is also susceptible towards the sulfonamide, right? Now talking about the next, which is the chlamydia, the listeria, are also susceptible towards the sulfonamide. Toxoplasma, which is in protozoa, is also susceptible to the sulfonamide, and pneumocystis is also susceptible for your sulfonamide. Now what's the important point you should look for? That the activity towards the pseudomonas is no. Okay, there is no activity towards the pseudomonas, right? If you are looking forward for a drug which is active towards the pseudomonas, then sulfonamide is not going to be your choice of drug, right? Because it do not show any of the activity towards the pseudomonas, right? Now talking about the activity towards the anaerobes, it has no activity against the anaerobes too, right? Now if we talk about for what treatment purpose we can use the sulfonamide, so in the urinary tract infection we can obviously use this particularly sulfonamide. I'll discuss it later on which particular compound we could use to treat the particular UTI infections, right? Now secondly, otitis media, right? The ear infection in the middle region of the ear, if there would be the inflammation, then we can use this particular class of drug. Okay, now similarly, I had told you that the pneumocystis pneumonia, if there would be the pneumocystis pneumonia, the sulfonamide could be used as a choice of drug, right? If there is an inflammation of the sinuses that are there in your skull, okay, if there is going to be an inflammation in your sinuses, means the sinusitis, then the sulfonamide could be used, right? And in the case of the prostatitis too, the sulfonamide could be used. Okay, now moving forward with the classification of the sulfonamide. See, there are several examples. I had wrote many. You can just, for the descriptive purpose in your examination, you could just remember easily 2 or 3 examples. Those are more than sufficient. Okay, so if we talk about the classification, so it is also based on the duration of action. So there are short acting, intermediate acting, long acting, and ultra long acting. Now, based on the action also, there are following actions, because the organ specific if we talk about, so there are gut acting, UTI acting. If there are wounds with the burn, okay, there are several drugs of the sulfonamide that are going to treat the wounds that are concerned with the burn issues, right? And the eye infection could also be treated by the sulfonamide class of drug, right? So if we talk about the short acting drugs, right, so the example are sulfathiazole, sulfamethazine, sulfadiazine, sulfamirazine, and sulfapyridine. You can just remember 3 of them. Okay, just learn any 3. The 3 name is sufficient for your descriptive answer in your examination, right? So if we talk about the intermediate acting, it's the sulfadiamidine, sulfamoxazole, sulfafenazole, and sulfamethoxazole. Okay, any 2 or 3 example is sufficient for your descriptive answer. Just do not fear of the classification. Okay, if we talk about the long acting, just remember the last term as the pyridazine. Okay, then add sulfamethoxy, sulfaethoxy, and sulfachloro. Okay, so what are the example for the long acting? It's the sulfamethoxypyridazine, sulfaethoxypyridazine, sulfachloropyridazine, and one more example is there, that is the sulfadimethoxin. Okay, now if we talk about the ultra long acting, means it is the duration would be more than 1-2 days, right? Means the duration would be longer, means you don't have to give the repeated dose through the recipient. Okay, the person who is going to take the drug, you don't have to give the multiple dosage of the drug. Okay, because this particular drugs are long acting, means ultra long acting. They are the long acting and the ultra long acting are there. Okay, so the example for the ultra long acting are sulfadoxin and sulfamethopyrazine. Not the pyridazine, it's pyrazine. Okay, just do not confuse with the long acting. Okay, now if we talk about the drugs that are concerned with the treatment in the UTI infections, okay, the urinary tract infections could also be treated with the help of the sulfonamide. If we talk about which class of the drugs that could help in the treatment of the UTI infection, so it's your sulfa-isoxazole, okay, and sulfa-isomidine. Okay, these 2 sulfonamides could be popularly used in treatment of the UTI infections, right? So sulfa-isoxazole and sulfa-isomidine are a good choice of drug for the UTI infection. So if we talk about why they are good, because they are highly H2O soluble, means they are highly water soluble, and they are highly soluble even in the acidic urine. Okay, the sulfa drugs are acidic already, okay, but they are still active at acidic pH of the urine, right? Sulfur drugs are already acidic, but still they are also active at the acidic urine pH, right? So this was about because this is the only reason why they are effective in the UTI infection, because they are even in the acidic pH, they are highly soluble and effective. Okay, and they go under least acetylation. Okay, if we talk about the if we talk about your metabolism purpose, so it will go under the least acetylation. Okay, if we talk about the metabolism of this particular class of drug, so they undergo least acetylation. Okay, now coming on to the next, which is the sulfur drugs that are concerned with the treatment of the eye infection. Okay, if we talk about the sulfur drugs that are concerned with the eye infections, it is the sulfacetamide sodium. So sodium is the salt to make it more soluble. Okay, so the main concern is with the sulfacetamide. If someone is going to ask you which sulfur drug could be used for the treatment of the eye infection, so you could just name sulfacetamide as a class of drug. right? So it do come as a 10% ointment, or it do come as a 30% solution also, okay, for the treatment of the eye infection. If we talk about the gut acting sulfonamide, see, the gut is also going to be infected sometimes, okay? So for the treatment of the gut, okay, there may be an infection due to the gram positive aerobes and gram negative anaerobes, and your gram negative aerobes, okay, not the anaerobe. So when there is going to be the infection due to the gram positive aerobes and gram negative aerobes, the gut may be infected, right? So for the treatment of the gut in these situation, we can use three drugs, right? There are three drugs that we could just use in the treatment of the gut, okay? So it is the phentyl sulfathiazole, succinyl sulfathiazole, and sulfaguanidine, okay? These are the three drugs that could be used in the gut infections, right? So the phentyl sulfathiazole and succinyl sulfathiazole, how they are going to act, when they are going to reach the your GIT or the gut, okay, they will lead to the hydrolysis. There would be hydrolysis of these particular class of drug, right? So the phentyl sulfathiazole and succinyl sulfathiazole are going to undergo what? The hydrolysis in the GIT, right? And it will lead to the, if we are going to give the phentyl sulfathiazole, it will lead to phentylic acid and the sulfathiazole. And the sulfathiazole is the active compound which is going to treat the gut infection, right? If you are going to give the succinyl sulfathiazole, it will go under the it will go under hydrolysis in the GIT tract and will lead to the formation of succinic acid and the sulfathiazole, and that sulfathiazole is responsible for the treatment of the gut infections, right? If we talk about the sulfaguanidine, after the hydrolysis in the large intestine, it will lead to the formation of sulfapyridine and aminosalicylic acid, which is also acting as an anti-inflammatory action. Means if you are going to have an anti-inflammatory action along with the antibacterial action, you could just refer to the sulfaguanidine, because it will lead to the formation of the aminosalicylic acid after the hydrolysis in the large intestine, okay, and it is an anti-inflammatory action is also pursued by the sulfaguanidine. So it is also majorly used in the treatment of the ulcerative colitis in the case of the dogs, okay. Now discussing about the treatment of the wounds and the burns, means this is your skin, okay, if there is a certain wound or there is a certain burn lesion, okay, so you can use mephenide or silver sulfadiazine, okay. Both these two drugs could be used to treat the burn and the wound, okay. Now one important thing about the mephenide is it is not a typical sulfonamide. Why? Because benzene ring and the N4, means the amino group that is there at the benzene ring, is not directly attached to the benzene, okay, it is attached or separated by a CH2 group. See, understand. So this was the benzene ring, right? Here was your sulfur group, NH2, there was the NH3, right? This was the normal sulfonamide structure that we had studied above, right? If we talk about this particular mephenide, so the mephenide at N4 position, this is the N4 position, right? So at the N4 position, it is separated from the benzene ring by an what? CH2 group, right? So this you have to remember that mephenide is not a typical sulfonamide example, right? And it is also not inactivated by the pus or the PABA, okay. We had discussed in the general chemotherapy that certain drugs under the presence of the pus, they get inactivated or the efficiency get reduced, right? But the mephenide, what it has the tendency that it couldn't be inactivated by the pus, okay. That's the property of the mephenide that you should remember. Now another drug, which is the sulfaquinoxylin, it is used in the case of the poultry coccidiosis. So that's the percentage, which is the 0.125% in the feed you can use as a prophylactic, right? And it may lead to the deficiency of the vitamin K in the poultry, okay. So this was all about the classification. You just not need to mug up all this particular class of drugs. Just remember two examples from each, right? It's sufficient to learn about the two or three examples. It's sufficient. You don't have to remember all the 5 in the short acting or all the 4 in the intermediate acting. You can just remember 3 or 2 of them, right? Now moving on to the mode of action, which is quite important to know about the mode of action of the sulfonamide, right? So if we talk about the sulfonamide, what's the mode of action is. So what happened, as I had told you, that first of all, note is that in mammals, right, in mammals we do not synthesize the folic acid, right? Mammals do not synthesize folic acid. How we are going to get the folic acid? From the diet itself, right? But if we talk about bacterias, right? If we talk about the bacterias, so how bacterias are going to have this particular folic acid? They are going to synthesize that, okay? They are going to synthesize folic acid, okay? So mammals do not synthesize the folic acid. They get the folic acid from their diet. So how the particular bacteria synthesize the folic acid? So first of all, what happens? The pteridine residue. There is one residue which is known as the pteridine residue. So this pteridine residue is going to combine with the para-aminobenzoic acid, which is PABA, which is a structural analog of the sulfonamide, right? So when these two compounds are going to combine together in the presence of dihydropteroate synthetase, okay, when they are going to react together or combine together in the presence of dihydropteroate synthetase, it will lead to the formation of dihydropteroic acid, right? This dihydropteroic acid will further lead to the formation of dihydrofolic acid. Okay, I'm just overviewing the synthesis first. I'm not considering the mode of action of the sulfonamide right now. I'm just telling you the synthesis of the folic acid first. Okay, so what is happening? In the presence of the dihydropteroate synthetase, the pteridine residue is going to combine with the para-aminobenzoic acid to lead to the formation of the dihydropteroic acid, right? Then this dihydropteroic acid is going to form dihydrofolic acid. Now that particular dihydrofolic acid is now going to combine with the glutamic acid in the presence of the dihydrofolate reductase to lead to the formation of the tetrahydrofolic acid, right? After the tetrahydrofolic acid is going to lead to the synthesis of what? The purines and the pyrimidines that are important for the DNA structure, right? DNA and the RNA means the nucleic acid structure. They are quite important, right? So these particular purine and pyrimidine will lead to the synthesis of the nucleic acid, right? And the cell division and the bacterial growth will increase, right? So that's what the importance of the folic acid is. Okay, now how this particular sulfonamide and trimethoprim, which is in diaminopyrimidine class, okay, how these two drugs are going to inhibit the action of this inhibit the synthesis of this particular folic acid, right? How they are going to just inhibit this particular synthesis? So the sulfonamide, what it do, it is in a structural analog of the PABA, right? So it is going to replace the PABA, okay, it is going to replace the PABA to do what? To lead to the, it will want to lead to the synthesis of the dihydropteroic acid, right? Because PABA is an actual compound that is necessary to form what? Dihydropteroic acid, right? If we are going to replace any of the compound, then it will not lead to the formation of the ultimate or the desirable compound that we are needing, right? So the sulfonamide, which is in a structural analog of the PABA, it is going to replace the PABA and won't lead to the synthesis of dihydropteroic acid, right? It is going to inhibit the reaction at the very first step itself, right? So that's how the sulfonamides are acting to inhibit the bacterial growth. Now what happened? The trimethoprim is going to act on the second step, where the dihydrofolic acid and the glutamic acid are going to combine in the presence of the dihydrofolate reductase, right, to form the tetrahydrofolic acid. Now this particular trimethoprim is going to inhibit this enzyme. The sulfonamide isn't inhibiting the enzyme. It is a structural analog, and if it is going to replace the main compound, then we aren't getting the ultimate compound, right? That is desirable for the folic acid synthesis, right? But the trimethoprim, it is going to inhibit the enzyme. Okay, it is going to inhibit the enzyme. It is not replacing any certain compound, it is inhibiting the enzyme, while the sulfonamide is going to replace baba, right? I hope this is clear, right? So I will discuss about the synergistic effect of the sulfonamide and trimethoprim. Earlier also I had discussed in the general chemotherapy also about them. Okay, so that's how they are going to inhibit the folic acid synthesis. And sulfonamide do not affect the mammalian cell. Why? I have told you earlier, the mammals do not synthesize folic acid, right? They get that from their diet, right? That's why the sulfonamide or the trimethoprim aren't getting to infect the particular mammalian cell, right? I hope this particular part is clear. Now coming on to the pharmacokinetic properties of sulfonamide. So what are the pharmacokinetic properties of sulfonamide? So through the parenteral route, means the IV, subcut and the IM route, the rapid absorption is there, right? But oral absorption varies according to the species of the animal that you are considering, right? So the rapid absorption is there with the parenteral route, but the oral route, the absorption through the oral route varies according to the species. Okay, so in the polygastric animal, the absorption through the oral route is the minimum, right? And in the monogastric, it is maximum, right? Because the in the ruminants, what happened? There is ruminant, there is rumen, right? They are ruminant, there is rumen. So the rumen will lead to the dilution of this particular class of drug, sulfonamide, any drug. There are maximum drug that if you are maximum drug that we are going to apply in the case of the ruminants, we generally prefer the parenteral route. Why we are going to prefer the parenteral route? Because when we are giving the any drug to the ruminants, right? If you are giving any drug to the ruminants, it is going to be getting diluted in the rumen itself, because there are microflora in the rumen which may get to dilute that particular drug that you are giving orally to the ruminant, right? So that's why we do not prefer maximum time to give the oral drug to the ruminants, right? That's why, because it will lead to the degradation of that particular drug in the rumen due to the presence of the microflora, right? So if we talk about the sequence of the oral absorption, so the cat and the dog, they'll just completely absorb the particular sulfonamide, right? Horse and pig intermediately absorb the sulfonamide. If we talk about the ruminants, so it would take longer time to just absorb the sulfonamide drugs if we give through oral route. There is rapid absorption through the parenteral route, but in the case of the ruminants, it will be slower absorption. It will take longer time due to the presence of the microflora in the rumen, right? So if we talk about the monosodium salts of the sulfur drugs, right? So the IV route for the monosodium salts, right? Monosodium salts is preferable. Okay, IV route is preferable for the monosodium salts, and other to the IM and subcut isn't prescribed, right? So generally we give the monosodium salts of the sulfur drugs through the IV route, not through the another parenteral route, right? If we talk about the disodium salts, it could be given IV, IM or subcut. Okay, you can give it intramuscular, intravenous or subcut, right? If we talk about the sulfadiazine, what's the importance of the sulfadiazine is it could be used for the treatment of the meningitis. Why? Because it have a good ability to penetrate the blood-brain barrier and cerebrospinal fluid, including the placenta. Okay, it could also cross the placenta. That's what the property of the sulfadiazine is. So generally it could be used in the treatment of the meningitis, right? Because it have tendency to penetrate what? Blood-brain barrier and your CSF, means the cerebrospinal fluid, right? Now if we talk about the metabolism purpose, okay, if we focus on the metabolism of the sulfur drug, so the maximum of the sulfur drugs are going to be acetylated, right? They are going to be acetylated at the N4 position, okay? And rest, there are few sulfur drugs which also undergo the glucuronidation, right? But maximum of the sulfur drugs go under acetylation. There are few which go under the glucuronidation, right? So most of the drugs, sulfur drugs, are going to be acetylated at N4 position, but there are a group of drug which is known as triple sulfur, and they are what? They are sulfapyrimidine derivative. Together they are known as triple sulfur, and this triple sulfur includes what? The sulfadiazine, sulfamirazine, and sulfadiamidine. Okay, so these three sulfur drugs together known as triple sulfur aren't acetylated at N4 position. Okay, but maximum of the sulfur drugs are acetylated at N4 position, right? Together these three are known as what? Triple sulfur, and these are less soluble in the acidic urine and may lead to the crystal urea condition that we will be discussing about in the your what adverse effect of the sulfonamide, right? I hope the pharmacokinetic property of the sulfonamide is clear to you. Okay, now coming on to the drug interaction. See, obviously when you are prescribing certain drug to the patient, right, so you should remember the two drugs that you are giving to the patient, they shouldn't be antagonists to each other. Means they shouldn't be opposing the action of the drug. Okay, they shouldn't be opposing the action of the drugs, right, in the different directions, right? So the sulfonamide antagonist shouldn't be prescribed along with the sulfonamide drug. Likewise, there are certain compounds that are having what? The PABA nucleus. Means the PABA, para-aminobenzoic acid, is an inherent structural component of certain drug, like the procaine, butane, benzocaine, procainamide, and procaine penicillin. All of them contain what? The PABA nucleus. Okay, so we should not prescribe the sulfonamide drugs along with the compound that are having the PABA nucleus, right? And there are certain drugs like nicotinamide folic acid and choline, they shouldn't be given along with the sulfur drug. Okay, so there are certain compounds that bound to the sulfur drug like gelatin, okay, albumin, and peptone. Okay, because if they are going to bind with the sulfur drug, so the sulfur drug won't be available in the blood circulation to give an active response, right? If certain thing is going to bound a certain drug, you have read in the pharmacokinetic that too, that if a drug is going to be bounding with a certain compound, right, if it's tightly going to bound with a certain compound that is there in your blood circulation, then the free available drug which is going to act against the bacteria isn't being available in the blood circulation then, right? So that's why there are certain compounds that shouldn't be prescribed along with the sulfur drug, right? And I had told you earlier in the general chemotherapy also that the antibacterial activity of the sulfonamide get reduced in the presence of pus. Okay, I hope this particular thing is clear, right? Now coming on to the adverse effect, right? So the main adverse effect of the sulfonamide is that they lead to the formation of the crystals, right? They lead to the formation of the crystals. Now what happens that whenever we are going to prescribe a sulfonamide, right? Whenever you are going to prescribe a sulfonamide, you always tell the patient that always take plenty of water, and sometimes you also give them urinary alkalizer. Why urinary alkalizer? You have read in the pharmacokinetics that the iron are less soluble, right? They have less penetrability, right? But the compound which are non-ionized, okay, which are non-ionized, they are more soluble, right? So we always want, if you are going to give see, you have given certain sulfur drug which is targeting what? The UTI infection. So you want the drug to present in the tubular, okay, urinary tubules, right? So you don't want that the drug get absorbed in the blood circulation. You want the drug inside this particular what? The urinary tubule to have an UTI action. Okay, action towards the UTI infections, right? So you want the drug in the urinary tubule, right? So whenever you are going to give the urinary alkalizer, what it will lead to? It will ionize the sulfur drug, right? It will lead to the ionization of the sulfur drug. If the sulfur drug is going to ionize, okay, suppose Okay, so the sulfur drug is going to ionize. So what happens? The ionized form of the sulfur drug, if it is ionized, it won't be penetrating the urinary tubule, and it will be able to show what action towards the UTI infections, right? Because we do not want the sulfur drug to be getting absorbed inside the blood circulation. We want the sulfur drug to be remaining in the what, the urinary tubule, to show an UTI action towards the UTI infections, right? We want the sulfur drug to remain in the urinary tubule such that the action towards the UTI infection could be pronounced, right? So that's why we prescribe urinary alkalizer along with the sulfur drug, right? Now that's why if there won't be a plenty of water, or you aren't prescribing the urinary alkalizer, that's why it will lead to the formation of the crystal in the urinary tubules in the kidney, and will lead to the damage of the kidney, right? So that's what the main adverse effect of the sulfonamide is. So it is always prescribed that you take a plenty of water, or you prescribe an urinary alkalizer along with the sulfonamide drugs, right? So crystalluria is more common, I had told you, okay, and more common with the sulfonamide that are rapidly excreted than the slowly one, okay? You should remember this particular point. And renal toxicity is more common in the acetylated sulfur drug compared to the glucuronide one, okay? So you should remember that the sulfur drugs that are undergoing what, the acetylation, are having the more renal toxicity as compared to the sulfur drugs that are undergoing the glucuronidation, right? So the crystalluria condition is more common in the carnivores than the herbivores. If we talk about the two types of the adverse effect that we see in the sulfonamide drugs, right? So it could be the acute adverse effect, means the adverse effect is sudden, or it may be lead to the chronic adverse effect, mean it will lead to it will requiring certain time to just show the adverse effect. So in the acute adverse effect, you can observe what, renal toxicity, hemolytic anemia, and certain hypersensitivity. Now there is a drug which is, I told you about the sulfadiazine. So in the Doberman breed of the dogs, so the sulfadiazine, what it lead to, it lead to immune mediated polyarthritis. By the usage of the sulfadiazine, there sometimes it lead to what, it lead to immune mediated polyarthritis in the case of what, Doberman. So you should just prescribe the drug accordingly to the breed or the species, okay? While you are prescribing the drug, you should look for the breed and the species to just confer, or just to ensure that the adverse effect could be reduced. That's what the importance of the chemotherapy lectures are, that you should know that which particular drug is contraindicated in which particular species or in which particular breed, right? That's what's the importance of the learning about the adverse effect about a certain class of drug is, right? So you should remember always that which drug is contraindicated in which species and in which breed, right? Because the several combination of drug aren't going to be prescribed together, right? So if we talk about the chronic adverse effect, so in the chronic adverse effect, you could show hyperprothrombinemia. Cardiac arrest is also common case in the chronic, right? Majorly seen in the dogs, and it also lead to the inhibition of the carbonic anhydrase, which is also important in the transport of the oxygen, right, in your blood circulation. So it may lead to the inhibition of the carbonic anhydrase, right? So I guess this was all about the sulfonamide. Now talking about the potentiation of the sulfonamide. I had told you that too in the general chemotherapy also, that why we combine two drugs. So what's the importance of combining of the two drugs is to achieve the synergism, to prevent the development of the antibiotic resistance, to reduce the dose of a particular class of drug, right? So and to attain this, in order to attain the synergism with the sulfonamide, what we use the combination of the trimethoprim along with the sulfonamide drug. Why? See, we know that sulfonamide, what it will lead to, it will lead to replace PABA, because they are the structural analog of each other, right? And what the trimethoprim will do, the trimethoprim will inhibit dihydrofolate reductase, right? So the trimethoprim will be going to inhibit the dihydrofolate reductase, and sulfonamide will be going to replace the PABA. So what we get a sequential, we are getting what? Sequential blockade of what? The folic acid synthesis. Okay, we are getting what? Sequential inhibition of the folic acid synthesis. That is much desirable that we can get, right? If you are going to have two drug combination and they are acting at two different sites in a synthesis process, then it is more desirable for a particular patient, because the synergistic effect could be produced, the efficiency of our drugs could be increased, right? This dosage of a particular class of drug could be reduced, the adverse effect could be reduced for a particular class of drug, the emergence of the resistance could be reduced, right? So you should remember why potentiated sulfonamide are generally used, because it will lead to what? It will lead to the sequential blockade of the folic acid synthesis, right? And show what? Bactericidal effect. So the example for the potentiated sulfonamides, you could have what? Sulfadiazine along with the trimethoprim, and sulfadoxine along with the trimethoprim. Okay, and the potentiated sulfonamide covers both gram positive and gram negative bacterial. I had mentioned that earlier also in the while we are discussing about the spectrum of the sulfonamide. So the Klebsiella salmonella, your typhi, Haemophilus, Brucella, anthrax, HS, hemorrhagic septicemia, proteus infection, salmonella, and actinomycetes all could be treated with the help of the potentiated sulfonamide, depending upon the what is the physiological condition of the particular what particular patient is. Okay, and you should always take care that what is the current physiological condition of the patient is. Likewise, the crystal urea is more common in the case of the sulfonamide, right? So you should take care that there shouldn't be an extra load on the kidney of the patient, right? That's why we are going to prescribe that take plenty of the water and take what? Urinary alkalizer along with the sulfonamide drug. Whenever you are going to prescribe the sulfonamide drug, just take care that whether the kidney of the particular patient is okay or not, right? So this was all about the sulfonamide. So thank you everyone. Have a nice day.